Hello, friends and colleagues. My name is Dr. Yael Bogler, and I am the Assistant Medical Director of the Tuberculosis Clinic at Santa Clara County. Every year on March 24th, we observe World TB Day to raise awareness of tuberculosis disease. On this date, in 1882, Dr. Robert Koch announced his discovery of Mycobacterium tuberculosis, the bacteria that causes TB. In the 143 years since the discovery of the TB bacteria, we have not yet been able to eradicate this disease. However, it is important to remember that TB is a preventable and treatable disease. This year's theme for World TB Day is Yes, We Can End TB. Commit, invest, deliver. I wanted to take a minute to talk about what we can all do to end TB, and in particular in Santa Clara County. Our common goal is ending TB. All of us play a role in achieving this goal, and the first step in doing this is raising awareness. Tuberculosis is a leading cause of death worldwide from a single infectious agent, ranking above HIV and COVID-19. After a decline in access to care and TB services during the COVID-19 pandemic, the encouraging news is that there is a significant worldwide recovery in TB diagnosis and treatment services since 2022. In its latest Global Tuberculosis Report, the WHO highlighted that more than 8.2 million people with TB received access to diagnosis and treatment in 2023, up from 7.5 million in 2022 and far above the levels of 5.8 million in 2020. There is still a large global gap between the estimated number of people who fell ill with TB and the number of people newly diagnosed. This means that our diagnosis capabilities are falling short. In California, we are getting better at connecting patients to the care they need, which was our major problem during the pandemic. In Santa Clara County, we treated about 170 new cases of active TB in 2024 and provided preventative therapy to thousands of individuals with inactive TB.
Hi, I am Preeti Achuru, and I am one of the infectious disease specialists at the Santa Clara County Tuberculosis Clinic. And I would like to share with you some facts regarding tuberculosis that are specific to our county, which is diverse in both ethnicities and nationalities. Over 80% of the active TB cases diagnosed in the U.S. are in those who were born outside of the USA, largely in those from Asia and Central America. Second, there are ongoing disparities in access to care in regarding race and ethnicity. Worse, these disparities are increasing in our current political climate. Our mission is to guarantee that TB care is available to everyone, free of judgment and stigma. This way, people who are at the highest risk of TB infection can access the care that they need. Also, people with complex medical conditions such as diabetes, kidney and liver disease, HIV infection, and conditions that weaken the immune system are significantly higher risk of getting active tuberculosis infection. And lastly, tuberculosis is preventable. The main source of TB disease that we can manage are in individuals who have latent or inactive tuberculosis who later develop active disease. There are more than 2 million Californians with latent TB infection. However, of these, only 1 in 5 is currently aware of their diagnosis, and only 10% has been treated. Diagnosis and treatment of latent tuberculosis can decrease the incidence of active TB, and it is far less costly, both in terms of a person's health as well as in healthcare dollars, to prevent tuberculosis than it is to treat. Therefore, this is a call to our fellow colleagues. Think about tuberculosis when talking to your patients, as well as their risk factors. And for the general population, please ask your medical providers about being tested for TB. Working together, we hope we can reach our common goal of ending tuberculosis. Thank you.